The Healthier Workforce Center of the Midwest has served as a Total Worker Health Center of Excellence since 2006. The center is a collaboration between the University of Iowa, Washington University in St. Louis, University of Kansas Medical Center, Penn State University, Workwell, Kansas, and 2 Total Worker Health affiliates, the Nebraska Safety Council and the St. Louis Area Business Health Coalition. So this interdisciplinary expertise allows us to design, implement, evaluate, and disseminate research and best practices that can be tailored to the changing needs of employers and workers, particularly the needs of NIOSH priority populations and those working in high-risk industries. The center has 4 research projects, outreach and education, and a pilot grants program.
Our goal is to be leaders in the research, translation, and dissemination of total worker health policies, programs, and practices. To do this, we partner with researchers, employers, and practitioners in every aspect of the center. We offer solutions that prioritize organizational changes rather than putting the burden on individual workers.
A critical component of the Healthier Workforce Center is our ability to address rapidly evolving challenges and opportunities by leveraging resources in an expeditious way. For example, the center moved quickly to address the evolving opioid epidemic, workplace mental health, and supported employers in their responses to the coronavirus pandemic. We address these emerging issues by expanding research and construction, funding new pilot projects, and expanding outreach and educational activities. Over the next several years, we plan to host collaborative learning communities to address emerging issues impacting worker well-being. These learning communities will include existing partnerships and representatives from businesses and organizations within the Midwest.
Over the past several years, remote and hybrid work has increased exponentially, and supervisors have needed more training to be effective. However, the trainings have failed to meet the combined needs of well-being and productivity for supervisors and workers. My team is developing a training that will meet this need and will be testing the training in organizations varying in size and industry.
Construction workers use prescription opioids and other substances to relieve pain caused by work demands and injuries. In our previous research, we developed evidence-based workplace guidelines. We are currently refining these guidelines and adapting them for use by a broader range of construction stakeholders. We are working with the outreach team to use social marketing best practices to increase the likelihood employers and unions will use the guidelines.
Construction workers are at high risk for suicide. Our project will adapt, implement, and evaluate an evidence-based mental health and suicide prevention program specific to construction that was developed in Australia. Training and other interventions will address personal, cultural, and organizational factors that make construction a high-risk industry for suicide. The goals of the project are to increase awareness, reduce stigma, and improve help offering and help seeking for mental health.
Workers in nursing homes tend to be low wage and have high rates of illness and injury. Previous research has shown that interventions that address both safety and health improve worker well-being. We are investigating the needs of smaller nursing homes to identify the organizational factors that impact the adoption and use of worker well-being interventions.
Our pilot projects program engages new researchers and community partners to rapidly and effectively respond to emerging issues. The academic pilot grants are intended for graduate students, postdocs, and faculty investigators new to conducting research in the area of total worker health approaches. The community pilot grants support efforts by employers and other practitioners to develop, implement, and evaluate innovative total worker health approaches in workplaces.
The outreach team shares best practices from researchers and employers who have successfully used total worker health approaches.
The goal of outreach is to increase total worker health, knowledge, attitudes, and behaviors. We translate research findings into tools employers can use to create a healthier and safer workplace. We have a variety of options to learn about innovative ideas from community, employer, and researcher perspectives. We provide educational opportunities for employers and researchers. We also produce short videos and podcasts, online training materials, downloadable toolkits, newsletters, and up-to-date information on our research efforts. Our materials are available for free on our website.
We encourage you to visit our website at healthierworkforcecenter.org, sign up to receive our monthly newsletter, engage with our research and outreach teams, apply for a pilot grant, use our free resources, attend a workshop, and join our collaborative learning community.